Yeah, hop on up. Let's just take a peek. So here, it looks good, dude.
I actually have like more puffiness here than I do on my knee.
That's just downstream from swelling, but we'll get rid of that today.
So I just want to know like what I can and cannot do, because I want to do it right. I want to be smart.
Right.
But I also like want to get to work.
Well, I mean, that's kind of like, you know, when it comes to like a surgery like this, the best part is you didn't really reconstruct anything.
Yeah.
You trimmed out the tear, cleaned up some, like, there really is no what you can't do. It's just progress is tolerated. So my whole thing is like, let's be as aggressive as possible without being stupid.
Cool.
You know what I mean? So we'll just listen to your body. I mean, your range already looks good. We're missing a little bit of extension maybe. Squeeze this one all the way. Yes, so the goal today will be, actually, you can get full extension.
I'm close.
So,
it just doesn't happen naturally. I got to
well, you probably have a little bit of a fusion, probably inside the joint line, that's preventing that full. So we're going to do some lymphatic drainage to start. So, and I'll show you how to do self-lymphatic drainage. No more ice on this. I saw you icing it. No more ice.
Yeah.
Are you in pain?
No, it was just until the baseball went away.
Right. Yeah. So at this point, unless you're in pain, I would say hold on the ice.
Yeah.
We'll do some lymphatic drainage. I'll show you how to do that with your massage gun. If you do get some swelling, especially like post-exercise, that'll probably knock it out.
Cool.
And then I'm going to calibrate you on some blood flow restriction. We're going to start loading it up. We're going to do some BFR stuff today.
Let's do it.
All right. Sick. So you're a week out.
Yeah.
So it was a week ago today.
Yep, week ago.
Nice. Dude, it looks great. Let's just bend. Just bend. There you go. I'm just going to go to 90 here. I just want to see what this looks like. Yeah, you're a little short on the IR. Any pain or discomfort with that? Where do you feel that? In the hip?
Nowhere yet.
Okay. Let's just see how much flexion we got. Let me grab my little goniometer real quick. Let's slide it nice and slow with keeping your butt on that. Dude, this looks awesome already.
A virtual tomorrow, and then I believe there's like a 3 or 4 week one where
That's like 120. That's solid. Let's just flip over on your stomach for me. Tell me when you start to feel like any discomfort or how's that?
fine.
That's okay? You feel that in the front of the knee?
Now I'm starting to feel like the Band-Aid stretching.
Right. Dude, this looks great, man. These the portal sites. I mean, you'd have to really, we're not going to crank on this today, but so it's 64 minus 180. Yeah, you're looking good, man. I love that. Flip it back over. Sorry, I'm going to make you flip a million times. All right, so here's what we're going to do. This is pretty straightforward. I mean, again, if it was like an ACL or a ligament or something that was reconstructed, then you have to kind of respect that healing process a little bit more, because we could be aggressive with this just because he just trimmed it out. Yeah. If he repaired it, that's different, you know? So what we're gonna do is I'm gonna show you, you have a massage gun at home, right?
Yes.
So I call these pumping stations. This is part of like my advanced swelling protocol, which I'm gonna repackage and sell in 2024. But the idea is understanding where like the lymph node density is in your body. So we have a cluster of lymph nodes, kind of like where our psoas is, the anterior part of the hip, our groin, our popliteal space, right? So what you're gonna do is just like on the low setting, super light, like almost like you're barely touching your skin in circles. You go like 90 seconds here, so you're gonna put your leg up, whether it's on the wall or you pad it, pillow it up. So 90 seconds, small circles, barely touching the skin. And then you're gonna move down here. Same thing, 90 seconds, barely touching the skin, super, super light, just enough to see kind of like that ripple effect happen. Because your lymphatic system is superficial, right? A lot of that, the actual swelling evacuation system is in your skin, which is why you ever see like a hamstring strain like bruise up like 3, 4, 5 days later. That's kind of why, because it's all surfacing to get drained out by your lymphatic system. And then you can do 90 seconds behind the knee, and that's it. And you're gonna rinse and repeat. So once you go, you're always gonna start at the hip proximally, work distal, and then work in the reverse order. And you're gonna finish clearing the hip. Okay. So I usually do like 4 or 5 rounds of that. It should take you like 10 minutes. But like if you're doing your rehab or training at home, which I think you should, again, like you can start with some like landmine squats to 90, like be like heavy single leg loading on this side is full go. Because that'll help limit any atrophy you get on this side, right? So single leg, and then we'll do some high repetition blood flow restriction to finish today. So you're just gonna focus on just this for now. I'm gonna manually like drain the rest of this out, okay? All right, so for lymphatic drainage stuff, we're just keeping this super simple. I'm really just enough tack on the skin, just enough lotion to slide, but really just moving the skin around. So you're just gonna stay on that hip, Greg. And we're just gonna use kind of gravity to our advantage, and just moving this skin around is gonna just help create an external pump. So the lymphatic system doesn't have a pump. Like technically your heart is the pump for your lymphatic system too, but it's not strong enough to push all of that swelling out, which is why we always struggle with more swelling in the lower extremity. So you can have your shoulder surgery and almost not even notice it's swollen at all, but your knee will be it'll be like a softball, you know, because gravity's always taking it down. So, and what normally happens is your muscles become an external pumping mechanism for the return of that lymph to your circulatory system. People who get like lymphatic drainage massage immediately after surgery have less reliance on pain medications, or back to functional activity sooner, get range of motion sooner, and generally have better long-term outcomes. All right, let's see. I want you to flip it over for me one more time. How's that feel?
Feels good.
Yeah? Just the stretch on the, I mean, even this is. So I think the key is going to be elevation. You're going to get a little post-exercise swelling probably for the first few weeks, but I think it's easy enough if it's easy enough to manage, the benefit of training and just kind of continuing to provide some kind of stimulus so that you don't atrophy, I think is worth it.
Okay.
You know what I mean? So it's always a balancing act between, you know, you don't want to push it so hard that you're kind of laid up the next few days. But I think if we go with just straight sagittal plane movements front and back, but you know, this would be something where I'd start with like split squats, basic movements that are super safe and easy. Then again, in a week, if you're feeling like, oh man, this feels great, go to Bulgarians. Let's do this. We're gonna calibrate you on the Suji. So that's just gonna take like 5 minutes or so, and then we'll go from there. So the idea is we're gonna trick your brain into releasing growth hormone. So what we're gonna do is we're gonna restrict just enough venous return to make your brain think that you're bleeding out. So you're gonna start dumping growth hormone, your cardiac output's gonna go up, and we could use extremely low loads, so like literally less than 10% of your 1RM, and get the same hypertrophy and strength adaptations as 90% of your 1RM. So we're gonna do super high volume. We're gonna start with the quad extension, the knee extension machine, so full range of motion, and we're just gonna go 75 reps, and it's gonna be like a massive pump. All right, so you're just gonna lay still, don't talk, just breathe normal. It's gonna run through a few different builds. So what it's doing now is it's calibrating what is the minimal amount of cuff pressure to completely restrict your blood flow. So we're gonna work over the next couple of weeks, we'll work up to about 80% limb occlusion pressure, which is it's just a massive pump. The idea behind it too is because you have so much cellular fluid accumulation, the pump in your leg just from doing light weight is gonna feel like your skin's gonna split. But that's part of what stimulates the whole hypertrophy process. What would you rate that on a like difficulty scale? Okay, that's where I wanna be, under a 3. It's almost like, Mike, this is kind of insultingly easy, but we're gonna go a set of 30 and then we're gonna do 3 sets of 15 after that. So we're gonna do like 75 total reps. So most people do like 25, 15, 15, 15. We'll just go 30 and then 3 sets of 15 after that. How you feel okay?
Yeah.
Pump?
Feels good to
Pump City?
pump these babies up.
Let's go. Even at home, you can go super heavy on that right side. Right now, the enemy is just velocity.
Yeah.
You don't want to do plyometric work right now or anything like it's got a lot of velocity because that increases your risk.
Yeah. So
just give a day off.
Is more the thing I should be worrying
Yeah. Well, because impact is going to be the thing that swells you up more. So we're going to stand here. I'm going to lower it down just a touch. First set, we're just going to go single legs on these. How's that? Too much or is that?
No, it's good.
What's your RP there?
1 or 2.
Okay, perfect. Let's go 30. No pain with that, right?
Nope.
The moral of this story is, if stuff's reconstructed, you got to respect the biology of the healing.
Yeah.
Especially like an ACL, because you're taking a tendon and replacing a ligament, and there's a specialization that needs to happen.
Yeah.
When they just clean it up or trim something out, and there's no actual physiological change to the structure, we can be a lot more aggressive. 100%. Nice, dude. Nice. We got one more cluster for you. We're just going to do body weight hip thrusts.
Beautiful.
Okay? Standard hip thrust, we're just gonna go here, right? Just keep the rib cage and pelvis stacked, just drive straight through the hips. Same thing, 30 on the first, 3 sets of 15 after that. Anymore.
They don't do CPMs?
Nope. The whole CPM.
We didn't have one showcase.
It's great. Dude, dude, every year. Like I haven't been there in like the last 2 years. Right. So what we're gonna do is a stack of red light therapy and the NMES pump. So what I'm basically gonna do is use stim just to fucking pump this quad like crazy and just create a ton of venous return, right? That's what we're doing. So we're gonna go until we get a fast twitch response here. There we go. Let's go. It's alive!
Oh, baby!
There we go. That's what we want. So we created our own external pump, but this is non-fatiguing because your nervous system isn't creating the contraction, it's the machine. And we're gonna stack it with this. Bang. So the idea with the red light is warm, not hot. If it gets hot, let me know and I'll drop the table a little bit. Any questions?
Oh man.
So we're gonna go single, heavy single leg on this side. I mean, again, use that. I'm cool with you landmine squatting, like split squats, reverse lunge, that's all fine. For the first week, just for the sake of being conservative, like go to 90.
Okay.
Pause at 90, come out of it. Again, not like super explosive, but remember velocity is where the risk increases. And then over the course of a set or 2 sets, like just play with your depth a little bit and see how you feel.
Okay.
If you feel good, you're fine.
Okay.
If you feel like it's a little clunky or feels a little unstable, then just go short of that and train, and then hit that isometric hold just short of that range. I would say probably by the end of January, you're training normal. So it's just a matter of like over the next 4 weeks, just like let's ramp it up aggressively, but without being stupid.
Cool.
You know?
All right.